to the injectors that are watching, I personally feel like you are not doing your job if you're not telling your patients what the risks are. They should never be sitting in your chair doing a procedure and they're like, well, I didn't know about that.
Welcome back. I'm Lindsey.
I'm China.
This is Unfilter It, our podcast from It Aesthetix. So today we have a couple topics we're going to go over. First one is
we are talking about danger zones and the areas that are dangerous and why we say no to you in the clinic.
There are some people that are okay with injecting these zones. I may have injected some of these zones in the past, but now with my experience, choose not to.
So for me, some of these danger zones are specifically for the use of filler. So just to clarify the difference, right? Yeah. There is a difference. So sometimes people come in and they're like, I want filler or I want toxin. There is a difference. Filler is using a product that is either hyaluronic acid or others to fill a space, whereas toxin's using a medication to relax a muscle, which will relax the wrinkles. So for us, these danger zones are specifically for filler.
It's really in relation just to filler. Think of filler as we're adding volume. Think of filler as a gel. The reason why we don't love these danger zones is because filler can block the blood vessel. Think of you have a hose, you're kinking it, and no water's coming out the end. Why that's important to us is because if no water's coming out the end, the water is a representation of your blood. So that means no blood supply to your skin.
And not to be scary, but most people understand that like a heart attack and stroke are usually caused by a blockage in their blood vessels. It's the same thing we have to worry about in your face or other areas.
Right. So instead of an emboli blocking a blood vessel in your heart, filler could block a blood vessel.
Filler could be an emboli, but these vessels and spaces are much, much, much smaller. So that's why I don't love filler in those areas too. So I think this topic has been kind of hot on a lot of platforms because it's the more you know. You know, remember those like with the when we were a kid? You know, the more you know.
Yeah.
So now
that aged ourselves.
We did. Oh, damn it. So now with all the new knowledge that we have, so back in the day when you and I probably started injecting or like learning about injectables, there was like one filler. We shoved it in every place.
Didn't matter. Put it anywhere. Go for it.
We had no idea.
The skin, no big deal. Everything's fine. It'll be great.
Looking back at some of the patients that I treated, we probably had a couple vascular injuries that we didn't realize.
I think in general, it's more vascular occlusions than anybody realizes. And they resolve themselves because they're very tiny.
Right.
That's how it is. But major danger zones for me, we'll start with the nose.
Yeah.
One of the biggest danger zones. So if any of you heard of liquid nose job, liquid rhinoplasty, what else are they calling it? Non-surgical rhinoplasty. So that's when you take some type of filler. It could be any hyaluronic acid filler. I mean, some people will use other fillers as well. I choose to use only fillers that I can dissolve, just caution purposes. And you put a little bit under the nose, you're filling in, honestly, before the bump to match the bump so that someone's nose is straight. You could also put some in the tip of the nose to lift the nose, make it look a little more pixie-esque. I loved doing these in the past.
Yeah. And I do think, like, I'll just say as a caveat, there are people that do this really, really well. They do this a lot and they do it frequently. And, you know, I think when you're working with the nose, for me, the nose has never been an area of one, expertise, or two, passion. Like, I just never liked operating on the nose. I didn't enjoy the anatomical structures of the nose. I didn't love nose patients, to be honest with you. Like, I just felt...
In general, the nose is not that fun.
In general, the nose patients were just a little bit not easy to please because it's hard to match an expectation of someone when they're imagining what their nose could look like.
And it's the center of their face.
Right. So the nose was never a place for me, but I just wanted to add, there are people that do this really well, and you kind of have to really love it.
You have to like it. I really liked it. Choose not to do it now. a high risk zone for blindness, honestly. And I'm not into taking that risk anymore. I like doing it. Now I'm a little further into my career, and I feel like I don't want to say need to take the risk, because I didn't do, riskier things but it's like exactly like you were saying, you just know more about it now.
Yeah.
You might have seen more things, like there's more posted about problems from nose filler.
There's also a lot more
I'm just
studies
like,
out.
no thanks.
There's a lot more studies out now, and we know a lot more than we did years ago. So one of the major things that we talk about as far as danger when it's injectable fillers of the face is blindness, because blindness, when you come into a problem with fillers, is 9 times out of 10 not fixable. It's a permanent thing. So like you said, for me, I choose not to take that risk, because why would I? I will just send you to one of our surgeons for surgical correction that carries less of a risk.
Which is insane, right?
Which is insane. To put you under general anesthesia to have a surgical correction is less than a risk of sticking a needle in your nose.
But then I also think another reason is because you're doing it. Filler goes away.
Yeah.
Not always 100%, but at some point you're going to need it again. So think about, you're putting that patient at risk over and over and over again. And sometimes you don't get it. You can't get it right the first time, because they need layers of filler to layer it. So it's not necessarily a one and done.
That's a good point.
So it's like you're just repeatedly putting them at risk.
And now we know anatomically from our studies and use of ultrasound in the face especially, is that these vessels that are affected, that cause blindness, are very, very tiny. And they even did a study that measured how much filler is required to occlude the vessel, and it's like 0.001. It's like the tiniest amount that you can imagine. So, the nose
Like
is a no for me.
of a syringe.
Yeah.
100th of a syringe. Yeah, I saw that stuff.
Yeah, so I think for consumers out there, I mean, if you're a new injector and the nose is a place I would stay away from until
get a surgical consultation. We have great surgeons here. Come in. Other thing that I want to talk about for the nose is not just the vascular occlusion, but vascular necrosis. So say you get a vascular occlusion, it can cause blindness and necrosis. So we talked about the blindness, but let's talk about the necrosis. So this is if you're Googling online or looking on Instagram for filler complications, you're going to see skin necrosis, meaning you lose your skin. So that is probably more likely to, not that it's likely, this is all rare, but more likely to happen than the whole blindness thing.
Yeah.
So, and then it's a big problem.
And you can get necrosis in anywhere. And as a seasoned injector, I would say like necrosis and skin injury is the least of your problems if you're running into horrible complications. If I had to pick one, it would be that, because that I know we could correct easily. It's the blindness that's scary. And so I say this, if you're a newer injector, the nose is an area that should be
not taken
reserved
lightly
for more experience. 2, I personally feel that if you love noses and that's what you want to do all day, there are many people out there that do it safely. Get yourself a good mentor and like really learn the anatomy, learn how to do this safely.
So you mean I can't just do a weekend course? And
No
just
weekend courses. I mean, weekend courses are a great place to start, but don't come out of your weekend course thinking you're going to inject high-risk areas. That's just not.
Don't put yourself in that position. More importantly, don't put the patient in that position. You might not have the resources to deal with complications that, honestly, these courses don't even tell you about. So that's a big part of the problem as well.
Yeah.
So take it lightly. Get some really good training. If you ever are thinking about doing that zone. So which one? What do you want to do?
So my go zone, my no fly zone is the forehead and the glabella in particular. For the same reasons that the nose is a no fly zone, those same vessels are very small, and the vessels that we worry about in that area are connected to the retina, and the retina is responsible for your vision.
Yeah, so you got to think about it like I tell my patients when they ask me for these zones, and I talk to them about, hey, there's a possible, risk of blindness. It's small, but, and I tell them why I don't do those zones. It's in my spiel. But I said, think about all the blood vessels really in your whole body. It's just like a major subway system.
Yeah.
And
Do you
one
feel
leads to
that
the next, to the next, to the
most
next.
of your patients are surprised when you tell them about blindness?
Most of them say to me, oh, I've
Really?
had this
I
done
didn't know
before. No
that.
one told me.
Yeah, I get that a lot too.
Yeah.
So I think like to the injectors that are watching, I personally feel like you are not doing your job if you're not
Have to
telling
tell
your
them.
patients what the risks are. They should never be sitting in your chair doing a procedure and they're like, well, I didn't know about that. They should absolutely know
Tell
about
them
that.
the worst.
Tell-
It needs to be in.
I mean,
it
don't
needs to
scare
be-
them. You should also
Well, it
give
does
them
scare
maybe
them.
the
It
statistics.
scares them, but it's like, it's really slim, but
I tend to give the statistics of
Yeah.
like how often it happens, and in the event that it happens, what are we going to do about it?
right.
You
And
know,
I
I
tell,
think
and
that's
I always
important.
like to say to them, I want you to be educated so that if something is going wrong, you know something's going wrong.
Right.
And then you get in touch with me and we
So the
figure it out.
glabella is it, or the forehead area is an area that not only can lead to bad things happening with the eye, but like you said, Lindsay, it can lead fairly easily to tissue necrosis, which is the death of the tissue that causes open wounds and blisters.
Yeah, it could be terrible.
And it's not fun to treat because the forehead in particular, the skin is stretched really tightly over your skull.
There's not a lot to work with.
Right. So when that skin loses oxygenation, it tends to scar. And like we're not in the business of scarring or maiming people. So what do I recommend instead of filler when there's a etched in line of the forehead? We do smooth threads, which are they're little sutures that are loaded up on a needle that is totally safe to inject into the skin. They dissolve over time. They're not getting into blood vessels. They're not doing any
Causing
of that. And really with the smooth threads, the only complication that there is to worry about is you could get fairly significant bruising sometimes in that area. Worst scenario is infection because they are
Yeah.
dissolvable sutures. So I usually have my patients look out for certain things and we catch things
How long do
early.
they usually last? For
So-
patients listening.
Your results will last up into a year for most people. The suture will typically, in most people, lay under the skin for about 120 days. They're the same suture material that we use in abdominoplasty,
Yeah.
breast surgeries, all that. They're like absorbable sutures on a
Yeah.
much smaller, thinner scale.
Yeah, for me, I've injected the glabella once with filler. Don't love it, but I will just really tox you there.
Yeah.
I'll use your Jabot, Botox, anything, any type, and we're seeing you every 3 months and chilling it out, stopping those muscles. So you probably do still want to do that if someone gets threads too.
Oh yeah, we have
because
to
you don't want
detox
to
first.
smush on your threads and pull them and all that kind of.
Yeah, so the thing is with anything, you know, and if you're one of my patients, you've heard me say this before. I use like this paper analogy where, you know, if you have a piece of paper and you continuously fold it, you're going to have an etched in line, and eventually that line will be there for eternity.
Yep.
Right? So you have to stop the muscle action so that the skin stops folding there, and then we do something to fix it.
Then we do something about it. And for me too, if they're not going to keep up with the tox, you know, it's kind of like
Yeah.
then you're kind of, if you're just going to do it once, you don't want to waste your money kind of
Right.
thing.
Well, we have some people, like Dave, for instance, I think he was probably born with a line in between his eyes. Like that, some people just anatomically have an overshadowing of where that muscle lays, and it's really hard you can't just correct it with toxin. You need to do something else to beef up the tissue, whether it's laser or threads or something like that. What other
Okay,
areas?
the next one. Let's talk about filler for the temple. So temple area, we're all aging. You're losing volume here, and then we start to look a little Skeletor-esque. And people,
Peanut head.
yeah, people want to do
Peanut
something
head.
about it. For me, in the what I do love, let's start with what I love for the temples is a product called Sculptra. It's a biostimulator, stimulates your collagen to build and restore, and that's a great way to do it with limiting the risk. Why do you think filler's bad for the temple?
So I actually don't think filler's bad for the temple.
I do.
I love filler in the temple. I think that it can do really good results, but again, must be used with caution. And you know, I have changed my practice a lot. I think like I'm more likely to use a biostimulator in the temple now. For one, I want to see now where those vessels are, because
Yeah.
after my learning on cadavers and doing different injectable trainings and you see different types of patients,
Everyone's anatomy is
everybody's
different.
anatomy is different, and there's surprises that happen all the time. Like
There's
you could map out a
breakages.
face and then poof, you have a hematoma that from a vessel that shouldn't be there. So I have exhausted definitely more caution in treating this area. This is where I think ultrasound is
Key.
huge.
I think it'd be great for
Yeah.
there. Reason why I don't love filler in that area is because you have something called your temporal artery. And if that gets blocked, or if you get a little bit of filler in there, it's a risk for stroke. So I'm not about to be putting some filler somewhere that can potentially give someone stroke, just like how we don't want to cause blindness or skin necrosis or anything like that. So I'm very erring on the side of caution. But when we get our little ultrasound, maybe I will branch
Yeah.
into that. But again, with like blood vessels and anatomy and all that, we're anybody in the medical field. We learn anatomy so much. We read it. It's changing all the time. Like people have now, if you look in some anatomy books, there's new little vessel branches that were never there before. People are doing
Right.
more cadaver labs. And, like I'll look at tons of stuff with Codafana.
Yeah.
It's like an anatomist that's amazing. That's all around now. But it's like there's things there that we weren't potentially taught years ago.
Yeah.
It's things to look for.
For
and-
me, with the temporal anatomy, the vessel for most people is much larger than the vessels that we were talking about for the eye and the nose. So I feel more confident in treating that area to not cause a problem. But yes, I do think that it is definitely a high risk zone that needs to caution, and definitely not for newbies. No, you definitely need some experience there too. And so why is hyaluronic acid filler more risky than say your biostimulator?
just because of the viscosity of it.
It's the thickness of it. So you're using a liquid instead of a gel. So God forbid the liquid gets into the blood vessel. The blood is thicker than that liquid, so it'll
not
just
gonna-
kind of carry it along and not cause a problem. But if you're using volumes of filler that's a gel, could be a
Potentially
potential
a lot.
problem. Yeah, and for me, in my practice, if I'm doing temple, I'm keeping it under a certain amount. Like I'm not throwing fillers.
Yeah, no.
Syringe after syringe in that area. It is an area that you want
How
to
we are
treat.
with everywhere, though.
more
That's how you should be with everywhere.
conservatively,
You don't want
yeah.
to put a zillion syringes in one zone in one sitting. It's not safe.
Right.
Just
Yeah.
that's overall. That's just overall.
Can we talk about lip safety? Lip as a danger zone, please.
All right, lip is a danger zone. So I feel like lips as a danger zone, and this is why I say no to a lot of patients sometimes. There's a ton of vasculature around there. But mainly when I say no and I think of danger is when they're overfilled.
Mm-hmm.
Where's that
Yeah.
filler going to go? Yeah, we write about migration, all that kind of stuff, whatever. But real dangers, we don't want to cause some pressure necrosis on your lips. Like we're always necrosis, your skin breaking down. Like we're always worried about that. So that's a main reason why we tell people no. It's not because we're being stingy or something. It's a safety precaution.
We don't want you to look like
And
a
you don't want you to look
cartoon version
crazy.
of yourself.
Yeah. But some people have little lips and
Yeah.
they want more and more and more. So it's not always about overfilled lips being these giant crazy lips. It's just, it could be like, I have a lot of patients whose lips they're like paper thin.
Yeah.
They're like the hardest lips to fill it on the planet.
Yeah, it's
And
true.
you really got to go slow, or else they can also be overfilled and have pressure problems with swelling and things like that.
So with the pressure, it's because that gel is filling a space, and the space is not always very stretchy. So that weight of the filler can sometimes press on the artery that's supplying the blood supply to your lip and can cause a problem. So for me, my problem I have out there as lips as a danger zone is, unfortunately, I think lips are very complicated. I think lips are a complex structure.
It's funny. They are. And it's weird because that's like the first thing
I was just
every
going to say
injector
that.
learns.
Like in training others, that's like, I feel like people learn
Toxin
and lips, and that's like a good place to get started. But I find that lips have the most variable anatomy.
100%.
I feel like you kind of have an idea of where the vessels lie, but they could be superficial in some. They could be deep in others. They could be not where you expect it to be a lot of the time. and this is concerning. And there was some debate on some social media platforms about technique and what is the safest.
Oh, yes.
Because, typically we have an artery that runs, parallel to the border of your lips. And with that tenting technique that is very popular, are you actually putting your patient more at risk for an occlusion or
Potentially, you
a
could.
problem?
But then the other people were saying, well, if you're going, transverse,
Right across, sure.
then you could just go boom right in that artery and then back, fill the whole thing. So would it be better to just do a couple little pokes and entering it more, or just getting one long one, like if you were doing an IV,
I mean, so my technique for lips is a combination of those, but I inject very, very slow and very small volume. So I always warn my patients ahead of time, like, you'll probably get more pokes from me, but because I'm depositing like the tiniest amount of filler in each poke. And I do think it gives a nice uniform, natural result in a safe way. And plus the thing is, like, as you continue on your career in injecting, you start to be able to notice when the problem happens, like right before it's happening. So you can avoid it altogether.
Agreed.
Yeah. What other areas don't you like? Are there any other dangers?
I think we have to talk about tear troughs.
Okay.
So
Tear troughs, and I also want to talk about the chin.
Oh, the chin
area.
is going. Chin's going. It's the whole face. The whole face.
Just everywhere.
Everything to do is dangerous.
Everywhere we go is dangerous.
So tear troughs. I feel like
What is a tear trough?
tear trough. So it's right under the eye, and it's pretty much not the bags. Everyone thinks it's their bag. So we'll talk about a little bit of difference. But it's when you have a little bit concavity in your in your under eye, like you're sunken in a little bit. That is the tear trough.
The technical term is infraorbital hollows.
So there's a big difference between that and under eye bags. Everybody wants to come and get their under eye bags fixed with filler. So we tell them no, do surgery. And a lot of times why it's looking so bad on them, or why they're feeling like they're looking a little different, is actually because they're losing volume in their cheek. So a lot of time in these days, it used to be, even up until like 2 years ago, I would say, honestly, maybe even a year ago.
Yeah.
Fill the tear trough, blah, blah, blah. Everyone's kind of turning away from that and doing the cheek first.
Well, I
because
think
it makes sense.
that people actually also finally realize that if you look at a child, right,
They have a tear.
they have a hollow
Yeah,
there.
they have
It's
it.
supposed to be there.
Yeah.
It's like, and I think a lot of the times, at least what I've seen, is when people are correct it too much, where you erase the hollow altogether.
Oh, then it's like that
They
Kylie
start-
Jenner picture.
Well,
It's
poor-
all over Instagram.
Yeah, I
It's
mean,
like, she just had a bad day.
I think you start to
Looks
look.
like she might have been crying all night.
Yeah, it could
Like,
be. I
everyone's
mean,
harassing her.
I think it starts to look allergic. Like you have
Yes.
like allergic
Swole,
shiners.
The swole look.
Yeah.
So my thing was always undercorrect and follow up. I never blew a lot of filler under the eye. I think I might have had one time, then I had to dissolve it a little bit. Someone had a little chronic swelling. Which
Too,
could
I
happen.
think a lot of people
Yeah.
don't realize that the filler lasts for years
Under there.
in
Yeah.
this space. Like, I mean, not just what the pharmaceutical companies are telling you. We used to say like 2 years, 3 years. Like, we have data up to 15 years where they're finding filler
There.
lasting that long in that area. And it's tough because this area lacks a lot of lymphatic drainage. So if you have a problem with lymphatic drainage to begin with,
It's gonna make it worse.
filler should not go under there.
So if you're someone that gets swollen under your eyes, if you're getting seasonal allergies like all year, you are not the candidate for under eye filler, even if you just have the hollow and no bag.
Yeah.
Just don't do it. You're gonna get so swollen. It's gonna look worse.
And definitely, like in
Yeah.
my practice, we never touch a under eye until we have established a cheek
Absolutely.
foundation.
And there's also same things, filler on tear trough, risk of blindness. I still tell my patient those things. I feel like it's a little less there. I don't know. But it's on the least of the blind danger zones, I feel like.
So, moral of the story, we want everyone to be safe. And so I think that, if you're an injector, do your homework, take anatomy courses, study the
precaution.
anatomy,
The
learn
yellow
your
light.
patients. Yes. And then if you're a consumer, just choose your injector wisely, ask some questions. How many patients have you done this on? how do you manage complications? These are
Yeah,
questions
it's
I
okay.
love asking. I love
Looking
answering actually.
Well, they should know.
Yeah.
And if you're going in and they're not telling you any of the types of complications,
Red flag. And then
that's
red
a
flag if they get pissed off that you're asking these questions.
Yes, if it starts to get weird, then like trust your gut and move on.
So I think we'll save the chin for our next episode where we talk about cool cases.
Yeah, we could do that.
So thanks for tuning in to our Unfilter It podcast. We'll see you next time.